I'm here with Virginia Scott, and she's going to tell us what she does because she's doing a new thing, which is integrating kidney care into primary care. So Virginia, how you doing?
I'm doing great. Thank you for inviting me to do this with you today.
Awesome. So tell us about yourself and what you do.
Dr. Virginia Irwin-Scott. I'm a nephrologist, and at this point in my career, I'm the National Director of Kidney Care at ChenMed.
Okay.
I am serving a primary care organization and bringing valued kidney care to the organization and improving the outcome of our kidney lives.
Awesome. So tell us about ChenMed. What does ChenMed do as an entity exactly?
So ChenMed is a primary care organization that works with Medicare Advantage patients, Medicare Advantage, Medicaid in certain populations. They are a full downside of risk organization, so they take and assume the risk of all their patient care.
Okay, okay. And so you as a nephrologist, how do you fit in there exactly?
So recognizing the costs associated with kidney care and ESRD patients and dialysis and late stage patients as they progress towards ESRD, organizationally there was an awareness of the need to have a kidney care program to help improve outcomes and to control cost.
So in your role, are you kind of like the curbside for a lot of the primary care with certain aspects of kidney disease?
Yes.
Or what?
So I say that that's probably about 50 to 60% of my life is doing curbside consults for primary care providers.
That's amazing. That's amazing.
Yeah. And it's awesome because I see them grow in their nephrology knowledge and their confidence in making decisions for kidney care. We try to maintain our upstream kidney patients into the primary care model. The PCPs only have a panel of 450 patients.
Okay.
So it's a very high touch model,
awesome.
High care, and it allows for those patients to be managed more closely by primary care.
Well, 70% of kidney disease is either diabetes, high blood pressure, or vascular related. So it's really better primary care management that can lead to better kidney outcomes in that scenario, right?
Correct. So the KED measure, that is one of the new HEDIS measures, specifically addresses presence of albuminuria and the GFR.
Yeah.
And the trigger is really, is there the presence of protein in the urine? And let's get these patients on treatment as early as possible to slow down that progression of chronic kidney disease. And that's the primary care space.
So you in your role don't stop the referral to a nephrologist, you kind of just assist in the care,
so
right?
There's one nephrologist in this country for every 3,800 CKD patients.
Yeah.
It is important for us to train and empower PCPs to be able to do upstream management so that nephrologists are available to take care of the sickest patients that need their care.
100%. And towards that latter stage of CKD 4 and 5, are you assisting with optimal starts,
yes.
transplant referrals, all that kind of stuff?
So we have something called the ChenK program.
Oh, awesome.
Chen Kidney
That's
Care.
That's a cool name.
Yeah, it really is.
Yeah.
And it is a team of nurses who come from the dialysis world, some RNs, some NPs, but they all have worked in dialysis in their career. So they come to me with a lot of knowledge and they understand that we are looking for the same outcomes as every other value-based care company out there. And optimal starts, PD growth, lack of, no dialysis catheters, trying to get patients to have grafts or fistulas at the time of dialysis start, decreasing hospitalizations, rehospitalizations, all that is the same metrics that the rest of the value-based care nephro world is living by. That's what my team lives by as well.
A nephrologist that used to be in private practice, I remember feeling really isolated, not having logistical support around me. So if a primary care is able to provide that for me, seeing the nephrologist, I think that's a win-win, right?
So the ChenK nurses are really the concierge managers who, the patient has their cell phone number, they reach out to the nephrology office, to the vascular office, to the primary care, and they coordinate the care of that patient to improve the outcomes.
Awesome. Well, thank you so much.
Thank you.
Take care.